Mygo seating system instructional video. Clinical setups for postural management. Hip laterals with pelvic cradle only. To set the width of the hip guides, loosen the Allen bolts, adjust to the desired width and retighten. Pelvic harness. To adjust the depth of the pelvic harness, move the snap fastener to either position. Adjust the support straps to the required length. Ensure the buckle connects securely in the middle. Pelvic cradle. The pelvic cradle should be flat and open when the user is placed into the Mygo seating system. First, fasten the buckle at the front of the pelvic cradle. Then fasten the Velcro at the sides to fit the pelvic cradle to the user. Then adjust the front and rear straps and to secure to the position of the user's pelvis. Backrest depth. The backrest depth is adjusted by depressing the popper, then sliding the back support tube to the desired position. This is very important as it will ensure the seat will fit the child both when they are upright and in a reclined position. There are 3 settings where the popper can be located. We recommend that you measure the child's upper leg length to define the required seat depth, SD. To do this, measure from the child's lower back to the back of their knee, then set the backrest to position. Backrest height. The overall height of the backrest can be adjusted by loosening the 2 socket cap bolts, then positioning to the required shoulder height of the user. Once in position, the socket cap bolts should be retightened securely. The height can be fine-tuned when the user is in the seat. Backrest angle. There are 2 angle indicator strips on either side of the back adjuster. The backrest can be angled by loosening the bolt. Select the position you require, then retighten the bolt securely. The backrest angle can be adjusted with the child in the seat, but always support the backrest with one hand. Upper leg guide lateral supports. To adjust the leg guides, loosen the locking levers under the seat and slide leg support to required position. Keep the supports pointing straight forward at this time, unless wind sweeping or adduction, abduction must be accommodated, in which case set the angle accordingly. Retighten bolt. To increase the angle further, remove bolt and move leg angle to wider setting. Femoral gables. To adjust the width or angle on the lateral supports on size 2, loosen the bolts from above, move the guides and retighten the bolts. To adjust the width of the knee supports on size 1, loosen the bolts on the underside of the leg support. Footplate height. To set the height of the footplate, loosen the bolt on the front of the calf support tube and slide the footplate to the required height and retighten the bolt. There is a safety popper to indicate maximum safe extension. To adjust the angle, loosen the bolt with the multi-tool, set to the desired angle and retighten. Footplate angle adjustment. To set the angle to accommodate plantar flexion or dorsiflexion, simply loosen or tighten the hand knob to select the angle you require. The footplates can simply flip up to a transfer. Adjusting the knee pads. To adjust the knee pads, lift the front cover, adjust the Velcro straps to the desired length and reposition in place. To remove, unclip the snap fastener on one side. Flexible sacral support. To adjust the height, depth and angle, loosen the bolts on either side with the multi-tool provided. Adjust the support to the correct angle, then retighten the bolts. Lateral supports. Loosen the socket cap to adjust the width, height and angle of the lateral support and retighten when you have achieved the desired position. To move flip-away laterals, use the knob. Chest harness. To change the width of the chest harness, lift the front cover, adjust the Velcro straps to the desired width, and replace the cover. Shoulder support laterals, size 2 only. To adjust the angle of the shoulder support laterals, loosen the screw on the top bracket, move laterals to required angle, and retighten. Contoured head support. To adjust the height, depth and angle of the contoured headrest, loosen the hand knobs, and when set to the desired position, retighten the knobs. Armrest adjustment. To adjust the height of the armrest, loosen the hand knob, set to the desired height and retighten. To adjust the angle, rotate ratchet handle until the desired position has been achieved. To remove the armrest completely, loosen ratchet handle, press popper, and lift the armrest. Tray adjustment. The height and angle of the tray is set by adjusting the armrests as shown previously. To remove or adjust the depth of the tray, loosen the knobs under the armrest, set to the desired position, and retighten securely. Height adjustment, high-low chassis. To adjust the height of the high-low chassis, press the foot lever at the rear of the chassis or press the up button on the handset of the powered option whilst holding the push handle. Once you remove your foot from the pedal or your thumb from the handset, the seat will be fixed at the chosen height. For safety, the height adjustment pedal on the chassis can be locked by engaging the pull pin on the right-hand side of the pedal. To unlock, pull the pin out and rotate 90 degrees. The pedal can then be operated. The locking pin should be kept in the locked position when you are not adjusting the chassis. Tilt in space. To adjust the tilt angle, press the lever under the seat base. Once you have selected the angle you require, by simply removing your hand from the lever, the chair will be locked in position. The tilt-in space should be locked off while the user is in the seat. To lock the lever, twist the pull pin to the right-hand side of the lever and the pin will pop into position.